So additionally to the 11 million, we closed an addition $20 million.
Arre wah, congratulations.
Yes, thank you. We were customer zero because we lived that entire experience, right? And I kid you not, in a short span of time, less than a year, we were able to get him off insulin, so reversed his diabetes. He was walking about 10,000 steps on a daily basis because really got involved in his overall lifestyle. Probably added 5 to 6 years of overall life expectancy from a quality of life standpoint. Acquiring a customer in healthcare is also very expensive. You end up spending anywhere between 10 to 14 US dollars to acquire one Gautam or one Elwin. We as a platform become your first port of call. And because we're your first port of call, ultimately I'm your managed care provider, right? So that empathy and trust is inbuilt from a perspective where because I've been able to demonstrate to you that I can look after you, and I can look after you across multiple services as well. Because ultimately healthcare is all about being able to solve for one incidence after the other, right? Whether it's an acute case or a chronic case. Now, all our front-facing teams, whether it is your virtual concierges, whether it's your technician who comes to your home to basically pick up your blood samples, whether it's a doctor you're consulting on the platform, they all go through a clinical protocol. Funding winter has been tough for a lot of organizations who might not have the right either product market fit from a standpoint or the right fundamentals to ensure that how can we scale quickly? And I think AWS has been a boon for us in that particular standpoint.
Sharing is caring. That proverb seems lost in the wind for India's fragmented healthcare ecosystem. Over 13 lakh doctors, 1.5 lakh small pharmacies, and a variety of diagnostic centers still operate in silos. That means low levels of care for curing ailments, unexplored possibilities in preventing diseases, and negative outcomes for insurers. There is one startup, though, that is digitally healing this problem by connecting all the dots. Hello and welcome to Crafting Bharat, the one and only startup clinic providing free and quality advice on tackling strokes and master strokes in business. With me today is a founder who's building a healthcare platform that has transformed over 6 million lives with comprehensive care. Please welcome Elwinder Singh, co-founder at Connect and Heal. Elwin, great to have you on board.
Likewise, Gautam. Thank you for having me.
Thank you indeed. Well, let's see how health is wealth when starting things up in a highly complex and regulated space. Lessons from Connect and Heal served fresh on our first segment titled Ignite. All right, Elwin, हर कहानी की शुरुआत होती है. So let's look at the starting story of Connect and Heal, because Sanjay and Galveen, they come from the finance world.
Yep.
You come from the consultancy world.
Right.
Now, the three musketeers get together in 2016 and you start Connect and Heal. Now, the idea then was to bring back the idea of family doctors. I love that idea. I've always wondered why that concept is not there more. But I want to know more about the trigger that you had for starting this business and the pivot which came from we are doing family doctors as a concept. Now we are pivoting to connecting all the dots in healthcare. So, कहानी की शुरुआत कीजिए हमारे लिए.
Yeah, so we had three founders. So Galvin and myself are siblings. Galvin and Sanjay used to work together in their previous avatar in the bank. For us, I guess the trigger was basically looking after my dad. This was way back in about 2014 or in Malaysia. Classic case of a chronic patient suffering from diabetes, cardiovascular disease, obesity. It got to a point where we as a family really had to get involved in his overall care. Because he was deteriorating. And at that point in time, it was an eye-opening experience for us, right? Because we don't come from a medical background, running from hospital to hospital, specialist to specialist, understanding that all these various doctors were not talking to each other, and that was basically affecting his overall health. Both from a perspective where his medicines there were conflicts in his medicines, the treatment plans were not in sync, etc., etc. At that point, we decided that we really needed to take control of the situation. So we basically got involved in his overall care plans, got involved in his nutrition, got involved in his medicine alignment, his tests, etc., just to coordinate his entire
Fantastic.
experience.
But you got a first-hand look. You were, in a sense, customer zero
Yeah, we were.
for your startup. You
we,
got a first-hand look at the pain points, and
we
there are a lot of pain points
we
in
were
this
we,
ecosystem.
we were customer zero because we lived that entire experience, right? And I kid you not, in a short span of time, less than a year, we were able to get him off insulin, so reversed his diabetes. He was walking about 10,000 steps on a daily basis because
Fantastic.
really got involved in his overall lifestyle. Probably added 5 to 6 years of overall life expectancy from a quality of life standpoint. And that's when we realized that, hey, if we could make a difference with one individual, we can really amplify what we've gone and done with a very simple focus that coordinated care improves health outcomes, right? And at that point, incidentally, Sanjay was going through something very similar with his dad in India. And that's when we decided that, hey, this affects a lot more people than just us. And we needed to do something about it. At that point, I packed my bags, moved from Malaysia to Bombay. Did not know a soul in the country. Couldn't
As
even
all great startup stories evolve.
couldn't even speak Hindi at that point. Now I think I'm a little better. But yeah, and then Sanjay and Galvin subsequently quit their jobs as well, and that's when the journey started.
You decided to take the big
Yeah.
leap. And what a journey it has been. And I love the fact that the inspiration comes from home for you,
Yeah.
because you've seen it firsthand, the challenges that people go through when they're trying to make sure that their loved ones live a more richer and fuller life, and healthcare plays an important part. Now let's talk about what you do in terms of connecting the business. And I love the fact that you take care of everything. When we look at the entire healthcare system for a patient, they can access primary healthcare facilities virtually through your app. So everything from consultation to diagnostics to medicines being delivered, you're taking care of everything through that interface to make sure that it's an end-to-end experience. That's being the case. For every startup founder, it's like, paise kaise banate hain? So I want to know from you, the monetization aspect, how you are unique, and the monetization strategies which hold you in good stead. Because at the end of the day, all great ideas need to last long, and for that you need money. So take us through your journey.
I think so. Healthcare is a very complex industry, right? There's no real lifetime value for a particular customer. Unless you're a chronic customer, right? Because if you're a healthy individual, you probably only end up falling sick maybe 3 to 4 times a year, right? So it's very difficult to have that persistency from any particular customer per se. I'm talking about just general consumers, right? At the same time, acquiring a customer in healthcare is also very expensive. You end up spending anywhere between 10 to 14 US dollars to acquire one Gautam or one Elwin.
So CAC is
relatively
high.
is
And they say acquisition is 25 times more expensive than retention.
Absolutely. So from that standpoint, we decided early on that we did not really want to play the D2C game, because in healthcare, it's very difficult to build that brand and at the same time to control CAC, right? So here we decided to go after paying cohorts. We looked at the 3 main paying cohorts in healthcare: the government, insurance segment, as well as enterprises. And we decided we didn't want to do B2G work. Wanted to focus either on serving insurance companies as well as enterprises, and basically built out a solution to catering to their pain points. So what were their pain points? Their pain points were occupational health, which is basically running worksite clinics. So where an employee spends, let's say, 8 hours in a day, either for compliance purposes or to be a preferred employer, you would want to have a doctor on your premise, a paramedic on your premise.
That's smart.
So that's how we initially started, entrenched ourselves into a lot of large enterprises. And then over a span of time, a lot of these companies would come back and say, hey, you're solving a very big pain point for me, because you're providing delivery of healthcare at the source, right? Can you also now cater to my employees and their families outside the workspace where they spend 16 hours of their day, right? So there,
So it's similar to an insurer model where you can be on the corporate insurance, but once you step out, you are given a separate plan altogether.
Absolutely. So there we built a complete network, a network of hospitals, diagnostic centers, vaccination providers, etc. Today we have 50,000 odd providers on our platform on a cashless basis. Realizing that at that point we were solving for primary care, preventative care. We realized the emergency response is also a big pain point for a lot of people in this country. Sure, you have 108, you have 102, but turnaround times to basically get emergency care really differs from where you are based, city to city, state to state. So there we saw an opportunity where there was a company that was running an Uber model of ambulances, decided to take the assets, the tech and the team and the network across. And today we are one of India's largest emergency response providers as well. So that's how we initially connected the entire dots.
So it's a chain of pearls strategy.
Chain of pearls, yes, exactly.
Fantastic. I love the fact that you approached it from a common sense perspective, because once you go enterprise, you build the base, then you work on the D2C aspect. And that's where I come to my next question on affordability. Because once that person goes out of that enterprise plan to an individual plan, how do you then address the affordability issue?
So two parts to this, right? One is from a subscription perspective, where we basically are able to pool the entire risk for an individual and their family, right? And hence we are able to cover a wider segment. And that's one aspect of the affordability piece. Second piece is if you need a certain pay-as-you-go service, right? Like
a consumption model.
A consumption model. I'm a little unwell, etc. But because we have a very large enterprise base as it is, we have pre-negotiated tariffs with all the major hospitals, clinics, doctors across the country, which basically means because of cost economics of scale, you end up paying a slightly lower price point, right? The other aspects of the affordability piece is that healthcare is very opaque, right? You don't really know why you're being charged X or why you're being charged Y. We bring about price transparency on the platform.
It ensures consumer trust. So what they see, what are the line items which are there on the bill, and then they understand, all right, iska to itna kharcha hoga.
Absolutely. And then the last piece is we've now started owning clinical assets as well. And therefore, you are able to not just make a service fee, you're also making the clinical margin, which basically means I'm able to bring down costs even further for patients across.
But it's fantastic that because you're evolving organically, you know which assets to purchase rather than purchasing an asset and
then just force fitting it into your business.
Absolutely. Next point, what I want to bring is zara hatke hai, but it's connected to what we are asking, because Galveen wrote in an op-ed that healthcare service delivery is more transactional because often it lacks empathy and trust. Why? Because patients are consulting different doctors for their ailments or needs. That involves a lot of running around, as you explained to me what happened with you. And there is very little chance for human bonding in that process. So how is Connect and Heal overcoming this void with technology? Because from a service delivery perspective, you're taking care of making sure you're always available to your customers and they have as many options to explore as they want. How does that tie into empathy and trust?
I think it's very important where we as a platform become your first port of call. And because we're your first port of call, ultimately I'm your managed care provider, right? So that empathy and trust is inbuilt from a perspective where because I've been able to demonstrate to you that I can look after you and I can look after you across multiple services as well. Because ultimately healthcare is all about being able to solve for one incident after the other, right? Whether it's an acute case or a chronic case. Now, all our front-facing teams, whether it is your virtual concierges, whether it's your technician who comes to your home to basically pick up your blood samples, whether it's a doctor you're consulting on the platform, they all go through a clinical protocol. And that clinical protocol is how we ensure standardization. And that as part of that standardization process and the training and retraining process, empathy is like one of the key pillars of what we try to do. Because ultimately, if I'm looking after any individual, how would I feel if I was looking after, let's say, my next of kin or my family members or anything to that effect?
And I guess there could also be some technological elements at play, maybe to match, say, a certain kind of doctor with a certain kind of patient, right? Because there's a certain personality profile. You can't match House MD with another patient avatar of that doctor. But if there is a connection built between the patient and the caregiver, that works wonders when it comes to retention. Let me take this forward before we wrap up the first segment and look at funding. Because sabse bada rupaiya. Now, I believe you raised a Series A funding of $11 million. I didn't read about anything else after that. So maybe you can clarify on that front. And also tell us how challenging has it been to propose, investment in healthcare startups to VCs, because there is a funding winter in
Yeah.
a certain sense. So how challenging is it? Because there are a lot of potential startup founders who are watching this show. So maybe from your experience, you can tell us key, how do you survive and thrive with the funding that you have? Maybe give us a picture on your revenue and profits.
Right. So additionally to the 11 million, we've closed an addition $20 million.
Are wah, congratulations.
Yes, thank you. A lot of it is, we're very thankful to our Series A investors who came in, because they've also topped up subsequently, and along with some other
So paisa aa raha hai.
paisa aa raha hai,
Okay.
right? And I think that's important. But I think more so from a perspective where healthcare is, as I said, it's complex, right? And whilst VCs have done a fantastic job being a catalyst for overall investment into this country, I think healthcare requires a lot more patient capital. And that's a very, very critical aspect, because it takes fundamental basis for healthcare is trust. And trust, it takes time to build trust, right? So I would say healthcare is an alumni business, because over time you are able to demonstrate that I'm able to look after all your health incidences, and then over time I'm able to then channel your overall health wallet into me as a platform, right? So it takes time to do that. It takes time to build clinical capabilities. It takes time to ensure you have a 10 out of 10 experience, right? And I think that's how we've approached this from a stepwise perspective. And obviously the funding winter has been tough for a lot of organizations who might not have the right either product market fit from a standpoint, or the right fundamentals to ensure that am I actually making money when I'm operating, right? So today, since you mentioned revenues and growth, etc., today we're doing about 25 crores on a monthly basis. So doing a run rate of about $36 million, just turned profitable as well. So for us, it's very important that we continue to reinvest into the business, because we really want to become India's preferred healthcare brand across the country.
Elvin, you've given us lots of headlines in that last answer, but what stands out for me particularly is what you said, that healthcare requires patience capital. That's the biggest headline out of our first segment. Well, it's time to move on. Time for a visit to the operating room to uncover techniques of scale management practice by Connect and Heal to personalize healthcare for millions on our next segment titled Launch. All right, Elvin, as per your website, and I think it is that you've reached 1 million transactions, if I'm not mistaken. Congratulations on that. So, Sone Pe Suhaga, you turned profitable, 1 million transactions. On top of that, you're available in over 450 cities. Your network of doctors is over 225,000. And you operate in a way that, you're the largest aggregator of ambulances, plus you have 650 clients across specialties. So again, for all the potential startup founders who are watching this, explain to them how you manage the scale and expansion by leveraging technology to make sure that it is organic, and more importantly, it's preventative plus curative, because that's where the healthcare play is also, because curative is a definite aspect. Preventative opens up a lot of avenues for customer engagement, because it's more connected to lifestyle. So it's expansion from the business perspective, but more importantly, the technology enablement aspect that it brings to the table.
Yeah, I think the way that we look at technology, right, is three-pronged. One is we look at it from the lens of the patient. We look at it from the lens of the provider. We look at it from the lens of the payer as well. Because whether the enterprise or the insurance company is paying for some of these services, we need to ensure that we are solving for some of their pain points as well, right? So in terms of how are we leveraging upon technology for all these different distinct groups that we cater to, right? I think from a patient perspective, the goal is very clear. The goal is, can I use technology to scale my services? And can I use technology to improve health outcomes as well? So I think from that perspective, whether it is doing geo-tracking of some of our providers who are delivering care on the ground, whether it is through efficient appointment management, whether it is through behavioral insights, triggers, etc. This is essentially what we are doing for patients. From an outcome perspective, that's where I think AI is also enabled in a lot of our own transactions to ensure that can I do predictive medicine as well, from a standpoint where I am sitting on your longitudinal health data. I understand what is your incidence rate. I understand what is your overall health risk. I understand what is the type of treatment plan that you may require as well. And hence that gets personalized from an individual to an individual capacity. Now, when I look at it from a provider perspective, can I make the provider experience a lot more efficient, especially when it comes to getting reports in very unstructured formats, right? And drawing insights from that perspective. Or whether it basically looks at how can I onboard a provider in a much faster manner, right? And that's where technology basically comes in. And from a payer perspective, how can I assist payers both from a financial and clinical adjudication to prevent fraud, wastage, abuse? And that's what we do from an insurance perspective, and we look at claims processing as well. So I think broadly, that's how we've looked at technology, leveraging it in each and every transaction, and also then trying to take insights out of it so that we are able to, again, improve outcomes at the end of the day for our patients.
I want to expand more on the AI aspect that you mentioned, because AI, of course, brings to the table the hyper personalization of healthcare at scale
Of
for
course.
you as a healthcare provider. So, what are some of the use cases that you're very excited about?
I think the use cases that we are like super excited about is primarily to can we create virtual AI assistants within the platform that is able to give you personalization for every single individual basis your overall health history, consumption patterns. I think that's one use case. Second use case is how do we become a lot more efficient internally as well? Can we use agentic AIs
Workflows.
to workflows, automate that, do it in multiple different languages as well, which you might not have that capacity to right now, right? And then the third piece is leveraging upon AI more from an overall data perspective, given the fact that we are getting data across wearables, we're getting data across your health reports, we're getting data across your behavioral insights, etc., etc. How do I create the digital twin to be able to improve our health outcomes? I think that's the three main use cases that we see today, at least within CNH.
Absolutely. So many possibilities open up when you approach data the right way. Well, let's get a dose of insights on how Connect and Heal leverages its partnership with AWS to create healthy outcomes in business on our mini segment titled Boost. All right, Elvin, when we look at the business,
Yeah.
while the banks had an open API framework for healthcare, it's the integrations
Sure.
framework, because you want to do more to connect the dots. You need to bring folks in
Of
as
course.
well. So, in terms of medtech integrations and interoperability of data to remove that information asymmetry, how is Connect and Heal working on the connect side of the equation to drive positive outcomes for patients and doctors? And in this, what are the product roadmap possibilities which are opening up due to your association with AWS? If you can give us the inside track on how working with AWS helps you become a better startup.
I think two parts, right? Especially from our own experience using AWS, and these two things are fundamentally critical to whatever that we do at CNH. Number one, how can we scale quickly? And I think AWS has been a boon for us in that particular standpoint. And I'll give you a live example, right? So when the pandemic hit, we were asked to do 2,000 odd consultations per hour, right? Because we were
Because everyone was going virtual.
everyone was going virtual. We were literally the emergency response system for a lot of large enterprises and effectively a lot of large communities as well, right? So just from a consultation volume perspective, we were able to do load balancing, auto scaling, etc., from an AWS framework, right? And I think that was like very, very thankful at that point in time, because otherwise it would have been very expensive for us. Second piece, I think from an information security perspective, right? Because we are dealing with patient data, we are dealing with large enterprises, insurance companies, etc., etc. So having that robust framework from an infosec perspective is extremely critical. And I think there we've been able to work very closely with AWS from an infosec perspective as well. From a product roadmap perspective, I think the thought process from our standpoint is very clear. Going forward, can we leverage on some of the data analytic tools that AWS has, right, to be able to draw better insights from across all the different longitudinal health data that we currently are sitting on?
So,
right?
what excites you on that perspective? Because once you have the analytics data, there's also something which AWS offers you in terms of creating those innovations on their platform.
I think for us is, again, can I hyper personalized, right? Using those insights, every single individual, depending on their overall risk assessment, can get a tailored specific OPD plan or a health plan from that standpoint. So I think that's very critical from our perspective. The other piece is when I'm looking at unstructured data with the help of some of the models that we're building with AWS, right? Can we potentially look to a mitigate any fraud, waste, and abuse? Number one, especially from a payer perspective, can we also specifically uh, curate different health products as well? Because right now we don't do a lot of work on the supplementation side. We don't do a lot of work maybe on the vitality side, etc. But I think those are given the fact that we are sitting on more than 6 million odd lives, everyone has a different digital twin. If I were to have specific insights accordingly, we might be able to, I mean, who knows?
Who knows what's next? But at least one
Create some new solutions.
new solution. That's what it's about. And if you're thinking scale, go with AWS without fail. All right. Let's expand the coverage of this talk to understand the economic opportunities opening up in India's healthcare space and, of course, the gaps that need to be sutured for a healthy progress to Mission 2047 on our final segment titled Orbit. All right, let's look at it from a broad perspective. And in terms of the possibilities opening up, I also want to look at the market because elder care, I've always wondered about it. I read a study which says that the elderly population in India is projected to reach over 319 million by 2050. Now, that brings to the fore the need for personalized and professional elder care services. So how is Connect and Heal looking to specifically cater to this segment? And in your opinion, how big an opportunity is this going to be for the next 5 years?
Right. I think it's a massive opportunity, honestly speaking, because right now India is sitting on a population dividend because we're a very young population. But in a matter of a couple of decades, we're going to be a very, very old population, right? Or an aging society per se. I think 35% of this India's population will be over 50 by 2047, 2050 odd, which basically means that if 1/3 or more of your population is going into that aging segment, right? Two things need to happen. You need to have a robust healthcare system, and you basically need to ensure that you're able to look after more from a productivity standpoint in terms of employers, employees, etc. When you have loved ones back home, right? So I think the way that we look at elder care is two parts. One is India has a very large migrant segment, so who are migrating between cities and between states. So how do we look after your elders back home remotely? And at the same time, if you're in with a nuclear family, etc., how do we look after your elders within some of the major cities itself, right? So making sure that you have
So that's your tier 1, tier 2, tier 3.
yes,
That's a smart way of
absolutely. So if you have coverage needs to extend across the board, right? So that's point number one. Point number two is can we have a function of not just remote healthcare, but also that in-person care? Because the minute you deal with elders and elderly populations, you need to be able to have that physical touch, right? Because that's where trust comes from again. So from that perspective, the way that we are building elder care is, number one, can we cater to all your domiciliary healthcare needs? So your medicines on time, your preventive care, your getting you a doctor that is your ongoing physician, number one. Number two, that's primarily on the services side. Number two, can we ensure that we are physically able to deliver these services to your doorstep? So whether you need nurses at home, whether we need to leverage on our emergency network to get you to the hospital. Can I send a concierge to take your elderly father or mother to your doctor's appointment? That's where the physical touch comes from. The third piece is that can we now look at the type of interventions that you have and how we are able to relay that information to the next of kin? Because ultimately, the next of kin wants peace of mind. I could be
and constant updates.
And constant updates. I could be in Bombay. My parents could be in Delhi. But I would really want to know whether have they taken their medicines? They've recently had a doctor's appointment? What did the doctor say? The nutritionist might have changed his diet plan. What do I need to look after for him? Right.
They would love a proactive service where you don't have to ask what's happened. Rather, the service gets back to you saying
absolutely. So that's where we come in from that perspective as well, to ensure that, again, we leverage upon some of that health information, relay that across, and also give you those advice and recommendations as well. Right. So I think broadly, that's how we're looking at elder care from a perspective of being able to look after you as the elderly parent, but also giving that peace of mind to the next of kin who could be anywhere in the country.
And I also see it as a significant driver of engagement, because if the person has a great experience interacting with your
Of
service,
course, yeah.
it behooves that, say, they will look at the service when they reach a certain age
Of
and say
course.
that, if I have had experience with this service, which has been great, I think it's time I use it for myself
No,
as well, so that
absolutely.
my kids get the same benefits that they get the same benefits that I got in terms of tracking the situation
No,
that
no,
my parent is going through.
absolutely, absolutely.
All right, now we come to the core question of the gaps that need to be plugged
Yeah.
in the Indian healthcare ecosystem. It's a very broad based question, so maybe a headline or two on the top priorities that
Yeah.
need to be fixed. Maybe we could look at, say, funding as an example. Any suggestions that you could offer on improving the funding environment? Because I believe the government had a funding program for medtechs which they launched last year. So do you think they should be doing something similar for health techs?
No, absolutely. I think so. Let's go into the problems first, and then maybe what's the thought process more from a public health perspective, right? Uh, in terms, I think the major problems that this country has from an overall healthcare perspective, especially as we strive to become a developed economy, is that number one, I think there is an urban-rural divide in this country, especially where a lot of healthcare infrastructure is concentrated into your major metros, tier one cities, right? So just to give you a quick statistic, a developed economy needs to have 3.5 hospital beds for every 1,000 people. Currently, India only has one hospital bed for every 1,000 people. And a lot of that hospital beds, hospital infrastructure is still predominantly in your major metros, tier one, tier two cities, right? So I think a lot of healthcare expenditure needs to be channeled into the right segments. We also have a situation where we have a workforce shortage across both your doctors, nurses,
I've
etc.
been getting mixed data, because while one data, and this has been released by the government, is that we have a higher proportion of a doctor to population ratio than WHO guidelines, it doesn't feel that we have enough doctors in the
No,
system.
it's because they're all concentrated in very, very high population centers.
Okay.
So in those high population centers, you will probably feel that I have probably 10 doctors on my street. Whereas if you go to a tier 3, tier 4 city in this country, then you don't really see that many primary health care centers or those community care centers.
It's a
That
problem of distribution.
it's a
It's not
problem.
evenly
It's a problem
distributed.
of distribution. But now, since we're looking at it from a 2047 lens, I think this is where I'm sure the public health system is probably need to progress from a perspective of being able to meet those metrics globally, right? So I think workforce distribution, tertiary care infrastructure, primary healthcare infrastructure distribution. And I think the third piece is then interoperability of health data. And I know that we've started on the right track through the ABDM framework, etc. But I still think that there is a lot more that can be done because adoption is still very low, right? So how do you accelerate adoption is probably the other lens that maybe obviously
Well, they're
public health.
trying. I mean, ABDM is the start, and of course, when EHRs, electronic health records,
Absolutely.
become mainstream, then we're hoping that a lot of
Absolutely.
the ecosystem players start working together.
Absolutely. Absolutely. But I think what the government has done is they've transitioned to becoming a payer, which is fantastic through the Ayushman Bharat framework, etc. But I think where now they can take the next step is to become an enabler of capital as well. Because I'm sure there are like thousands or maybe millions of entrepreneurs in this country who want to solve some of these pressing issues, but they probably just need that enablement or that start. And I think that's where, because you need patient capital in healthcare regardless. So it becomes
Absolutely.
more of a macro lens as opposed to, let's say, a narrow venture capital lens or a narrow a short-term investment lens, right? And I think that's where probably the government can take that first step to be that enabler from a capital perspective.
Well, you've given me the perfect segue for the last question that I have for you, Elvin, which is words of enablement to the many who are watching this show. Maybe they're thinking of having a healthcare startup associated with their name. What suggestions would you offer to them?
Okay, I have three things that I would suggest, right? Number one, you don't have to reinvent the wheel. There are a lot of solutions out there that you can build upon, right? And if you're able to solve a real world problem, get product market fit, and still leverage upon some existing technologies and smartly repackage them, that's probably a very efficient way to at least start and get product market fit. Number one. Number two, I think it always helps when you can find a mentor, because I think it's a lot of people make mistakes in this entire startup journey. So how do you save time and go to market as quickly as possible? So having that guidance from someone who's been there, done that, really probably saves you a lot of gray hair down the line, right? And I think the third thing is there's never a perfect time to start, because you have people who would say, "I will let me do X, Y, Z, and ABC before I get my ducks in order, and then I'll eventually take the plunge." But uh, as I say, there's no real right time. So if you are keen on starting something, you have a great idea, you think that you are able to impact a lot of people by what you are able to build, then I would say just start tomorrow.
Well, the right time is where you start. That's what the message is. But well, time's up though. On our consult with the founder of a healthcare startup on its mission to provide an affordable continuum of care across India. Well, we wish them all the best. And Elwin, thank you so much for joining us here on Crafting Bharat.
Thank you so much.
And thank you to our viewers for tuning in. Till next time, this is your host Gautam Srinivasan signing off.